Good morning, ladies and gentlemen. The Committee on General Government Operation, Appropriation, and Housing is now called to order. For the record, today is Thursday, June 25th, and the time now is 9:01. Notice for this budget hearing was disseminated via email to all senators and all main media broadcasting outlets. First public notice was issued on Wednesday, June 17, 2020, and second notice was issued on Tuesday, June 23rd. The committee will hear and accept testimonies on Bill 282-35 LS, the Fiscal Year 2021 Appropriation Act, as requested by the governor relative to the Guam Memorial Hospital Authority, Fiscal Year 2021 budget request. Joining me for this budget hearing is the Oversight Chair, Senator Therese Terlai of the Guam Memorial Hospital. My Vice Chair on Appropriation is Senator Amanda Shelton, Senator Jim Moylan. General rules for the budget hearing. Those testifying on behalf of the department will be recognized by myself, which we have the panel already present. Written testimony shall be submitted to the committee. Please provide my legislative staff with written testimony for photocopy. Testimonies may be read and lengthy testimonies should be summarized. Testimonies shall be confined to the substance. My colleagues and the panel, reminder, we are only discussing the budget of 2021. We may dip into 2020, but not much. Okay, individuals will be allowed to present oral testimony. Once you're done, you may be asked to remain in the room for further questions or for additional testimony as may be desired by members of the committee. Proper form and decorum shall be practiced by all present in the public hearing room for this proceedings. Individuals who fail to maintain proper form and decorum may be restricted from providing oral testimony and or may be asked to leave or be escorted and removed from the room. When you speak, please make sure that the microphone is on and that you speak into the microphone. You state your name and title for the record. At this time, I ask the panel members from the Guam Memorial Hospital to rise and for our Sergeant at Arms to please swear them in. Thank you, Sergeant at Arms. I'd like to also recognize that we're joined by my colleagues, Senator Mary Camacho Torres and Senator Telo Taidui. I would ask now the panel to please identify yourself and your title and then proceed on your presentation. Thank you.
Okay. Good morning. My name is Lillian Posadas. I am the hospital administrator. With me to my right is Ms. Yuka Echanova, Conception. Echanova, sorry. She is our acting CFO. Buenas and half a day, Senator Joe San Agustin, Chairman of the Committee on General Government Operations, Appropriations, and Housing, and all senators of this legislative committee. On behalf of the Board of Trustees, management, medical staff, and employees, we extend our gratitude for giving us this opportunity to defend the hospital's budget for fiscal year 2021. Before I go any further, I'd like to also recognize our executive leadership who are not here, but I'd like to recognize them because they contribute tremendously to the efficiency and the effectiveness of how we lead and how we operate the services of the hospital. And so that's Mr. William Kando, who is the Associate Administrator of Operations, Dr. Annie Berdalio, who is our Associate Administrator of Medical Services, Dr. Jolene Uggan, she is the Assistant Administrator, Associate Administrator of Medical Services. We have also Rodalyn Gerardo. She is our Chief Internal Auditor, which we are very, very fortunate to have finally an internal auditor in the hospital because for many years we've never had that specialty of expertise. We also have Ms. Gemma Beth Simbillo. She is our Assistant Administrator of Nursing Services. Ms. Christine Takaro, who is the Deputy Assistant, and Mr. Don Rabinow. He is our Assistant Administrator of Administrative Services. So that's our executive team for the hospital. I guess we'll just go right to, but did everybody get a copy of the PowerPoint printed presentation? We are not doing a multimedia presentation, we're just doing the old-fashioned way of paper presentation. So Before we get to the details of the 2021 budget, I just want to go over the first two slides of the PowerPoint document, which basically depicts the two major arteries, if you will. I know I'm using medical terminology because that's my background. Those are familiar terms for me. But these are the two major divisions, and the first one is the direct patient care, which is comprised of medical. And under medical, we've got anesthesia, we've got the doctors, employee health, infection control. We also have the quality management and the utilization review. So that's the medical division, medical services. Under nursing, we've
Ms.
got...
Rapadas, if you're more comfortable, you can bring it down while you're speaking, so,
It's not muffled?
yeah, just so that you don't look at your coin.
That I
Your
don't do
coin,
what?
you'll be okay.
Okay, all righty. Okay, I'm sorry. Under nursing, we've got, that's, nursing services is really the bulk of the services that we provide in the hospital. And that includes the emergency room, intensive care, nursery, in the maternal child health, we've got the labor and delivery, the OB ward, we've got medical surgical telemetry, operating room, and we have the hemodialysis. We have also the nursing administration services. And we have now, because of this COVID situation, we have COVID care units. Care Unit 1, Care Unit 2, Care Unit 3, and we're looking to have a Care Unit 4 because we're anticipating a surge of COVID patients needing hospitalization. We also have, at the Barragata Heights, our long-term care facility, which is what we call the SNF. We have transformed that to be the COVID isolation facility we call SIF, and that's specifically for isolation of COVID patients. I just want to bring that to your attention. Under the professional support services, we have the urgent care, the laboratory radiology, we have respiratory care, the rehab services, special services, the Heart Project. We also have the education and continuing medical education services under that, dietary, social services, the pharmacy, and outpatient clinic. The fourth arm of that direct patient care is the DOC clinic service. We have two on-site clinic services at the Department of Corrections compounds. That's the Hagatnya detention facility, and then we also have at the Manila adult care facility. And that's as a result of the consent decree in 2016 that the hospital was mandated to provide that medical services on site. So we've been operating that and we've been staffing it. In the indirect patient care division, the administration, under that we have the compliance administrator, medical staff, and the EEO. In the operations section, we have the central supply, materials management, that's where the procurement process takes place. We have safety, security, housekeeping. We have, again, the facilities maintenance of the skilled nursing unit. And we have the comm center. We have the IT service, MIS, guest relations, planning, and the human resources. Under fiscal division, we have the general accounting, internal audit, patient affairs, patient registration, and medical records. So those are the two major arteries of the hospital's operations. And so I'm going to hand over now the mic to Yuka to speak about the 2021 budget and the funding requirements that we're needing to continue this complex 24/7 operations and services that we're mandated to provide a public not-for-profit hospital. Thank you.
All right, are you going to be providing the slides like that you've handed out to everyone, or?
We provided
Are
copies.
you going to do any PowerPoints?
No,
or
sir. I mentioned
okay.
earlier, we're doing the old-fashioned way. We're doing paper.
All right, no problem. Thank you. Please continue.
Good morning, Mr. Chairman and all fellow senators. I'm going to go ahead and just jump into the numbers side of it. So our FY21 funding requirements and revenue projection is at $137.9 million, and 105.7 of that is from our operating revenues. This is a slight increase from last year's $104 million, and we projected not too much of a change. We looked at the last few months of our patient census and discharges, and that's how we came up with the new projection. It didn't go up by much, maybe about less than 1%. So we also have funding sources from GovGuam subsidies from the governor's budget, the Healthy Futures Fund of 1.7 million, the Pharmaceutical Fund 20.5 million, General Fund of 4.3 million, and we also have funding from the GMHA Healthcare Trust and Development Fund and the Limited Gaming Fund. So the total revenues projected is 137.9, and also the matching expenses of 137.9. So among the 137.9 million, we divided that, of course, we allocated it amongst the different divisions. So 78% of that, or 108.2 million, actually goes to the divisions that provide direct patient care, which is professional support, DOC, nursing, and medical, while the remaining 22%, or 29.7 million, goes to the indirect support of operations, fiscal, and administration. So if we compare from the last year's budget from FY 2020 and 21, the increase is not too significant. We did have a slight increase in contractual services. Mostly our budget is in personnel, of course, for salaries, overtime, and benefits. But the next biggest object category is contractual. So we have a lot of...
I'm sorry, could you just tell us which page you're on right now?
Oh, I'm on the one that says fiscal year budget summary by object class.
All right, thank you.
So the next category that's funded heavily is contractual, which is now 25.4 million. So about 13 million of that is actually for our doctors, our contracted doctors. So on the next slide, we also have a breakdown by the personnel budget of 93.9 million. Again, we have about 80% of that going to the divisions under direct patient care of 75.3 million. So that's nursing, professional support, medical, and DOC. Nursing gets the bulk at 41 million and 44%. That's the biggest chunk of our personnel budget. On the next slide, I presented a snapshot of where we are right now in May FY 2020. So our cash is at 10.6 million, which is a considerable increase from last year, May. We received a lot of money from the CARES Act funding, direct support, and that really helped our cash flow. So our cash is pretty good right now. Our payables are at 12.1 million, which is lower than last year as well. But included in the payables is about 4.8 million that we owe to DRT for the past withholding taxes and also the accrued interest and penalties. So our payables now is about 6 to 7 million because we did pay off the withholding tax and DRT did waive the interest and penalties. So our payables are also looking very good. Our collections are also a lot better. It's 62.4 million as of May 2020 compared to 54 million last year. We've been getting regular payments from Medicaid. It's been coming in regularly. We're also getting our allotments from DOA also regularly. It's been coming in as projected, so that's also, those two items have really helped our cash flow. Oh, and just to give you an idea of our revenues at this point in the middle of the pandemic, so when the emergency was declared in March, by the end of March, we had, compared to March of last year, we had a revenue loss of $950,000. Come April, a full month of the emergency, we lost 2.9 million compared to April of last year. In May, we lost 2.4 million. So this COVID pandemic has really affected our revenue streams. But compared to the year-to-date budget, we're still ahead about $4.8 million. On the other side, our expenses have gone up about 4.9 million. So we're evening out right now. I'm not sure, we'll know more about what June looks like. Our census has dropped tremendously, but this month it's been picking up, so we'll see how June looks. So on the next slide, we have a breakdown of the FY 2019 payer mix. So the 3 M's, the Medicaid, Medicare, and the MIP, make up $103 million of FY19 gross revenue, so they're 58% of our gross revenues. The insurance companies, 30% at about $54 million, and self-pay is 12% at $22 million. So on the next slide, we have the 2019 revenue expenses and patient census. So you can see the census has climbed in FY 2019. In 2018, GRMC closed their maternal child health services, so we believe that that may have contributed to the increase in the census. Our increase, we had a slight increase also in our operating expenses because we spent a little bit more on contractual supplies, payroll for overtime, and other pay, other incentive pay we give to the nurses and other healthcare professionals. And also we had to record a $400,000 impairment loss of our Z-Wing. The Z-Wing out in the front, that's, I believe, over 50 years old. We had to write that off. So the next slide shows the CARES Act funding, the details of the funding that we received. So 7.7 million came directly from Health and Human Services under their Public Health and Social Services Emergency Fund. And we got $965,000 from the initial $30 billion distribution that they had. The second distribution was the $20 billion relief fund that rounded out their initial, the $50 billion payout. So we got 1.1 million from that. We also received 5.5 million from their $10 billion rural relief fund payment for rural hospitals. And then the last payment we received just last month was 155,000 for the skilled nursing unit. We also received 11.9 million from the governor's CARES Act relief fund. We received 3.5 million for COVID-related medical expenses, 3.1 million for COVID-related payroll expenses, 319,000 for public health expenses for like supplies, and we also received 2.5 million for a patient central monitoring system expansion, and another 2.5 million for negative pressure and hemodialysis upgrades to the hospital. So a total of 19.6 million in CARES Act funding we've gotten. We also have 4.5 million we received from Medicare, which is actually in advance. So as soon as the emergency was declared by the president, Medicare offered upfront advance payment based on our cost report. And so we applied for it and we got 4.5 million, but this will be paid back over a year beginning in August. So right now it's actually a loan, but it did help our cash flow. The last slide shows our COVID-related expenses. So March, April, and May, the total was 2.4 million so far, and March was 366,000, April 964, and in May it was 1 million. Most of it is going to the payroll expenses that we have. We have excess payroll for overtime and additional pay, and also the differential pay has taken up a lot of that money as well. So that concludes the presentation. If you have any questions, we'd be happy to answer them for you.
All right, thank you. Well, you just took off 3 of my questions, all related to what you just last briefed, so that's great. You have vacant positions in FY 2020. I think it's about $16 million worth.
We have vacant positions, yes,
Will you
sir.
be able to fill them
We've been-
hopefully soon?
Well, we're trying to. And,
All right.
you know, a lot of the bulk of those vacant positions are in the clinical area, registered nurses, staff nurses, you know, radiology. We're still trying to find a chief of radiology and assistant radiology staff, and also the dietary services administrator. We've struggled with that position. We have the assistant administrator of professional support services. That position has been vacant. We also have the medical records administrator. So we do have quite a bit of vacant positions, sir.
All right. Okay, then we need to figure out a way how to make sure that you still have some money next year so that you can continue to keep it open and hopefully fill it as soon as possible. I think that would be a positive note on your behalf. And you know, I'm a strong supporter of GMH. That's number one. My parents go there a lot. I mean, they're one of the frequent flyers. Not saying that they need to go there, but if they're going to go anywhere, they'll go to GMH because they know the folks. And I know a lot of your employees there, and I wish we could do a lot more for you. Do you know if you got the 10 million that we approved in the budget? Not yet, right? Well, we're going to ask about that audit. What's going on in that audit? Because I know that Senator Therese would love to know if they gave you the 10 million. If the 10 million exists, that you got first dibs, so you can do what you need to do. And I know your financial person there is saying, yes, give us 10 million.
Give us 10 million, of course.
Another question is, does your department have any outstanding retro employee salary payment as a result of the Competitive Wage Act? And if so, how many employees of the status of their payments? You know, if any of your employees are due increments that were never paid in the past, we want to make all your employees whole. Okay, make them just get them up to date. And if you do have anyone, please, if you know it now, if you can, tell us. Do you know if you have anybody or?
No, sir. So far, the performance evaluations have been, some of them are finally catching up. And so once we get those performance evaluations that are due, their increment, we then sign off and HR processes their increment accordingly.
All right, that's great. That's great news to hear. I was going to ask you about your bad debts, but it's quite obvious that you're moving along and you're collecting. The Attorney General's office is helping, I'm assuming that?
Yes, they are one of the reasons why we're able to collect. They have been our collection agency, so it seems that when people get the call from the AG's office that they owe the hospital money, they call the hospital, make payment arrangements, or come and make a payment. It's worked very well. Okay,
and Department of Revenue and Tax is responding also when they got
Yes.
anything that's coming out, they're giving you the funds
The
and the tax refund.
garnishments, yes.
All right, that's great. Okay, I'm not going to ask about your DOA allotments. You answered that. They're coming in. Wow, you just ran me out of questions. Senator Therese Terlai, the Oversight Chair, do you have any questions?
Thank you very much.
Before you go on, ma'am, I hear they're going to try to find a way to build a new GMH or Guam Memorial Hospital or whatever name they want to put it.
That's the recommendation of the Army Corps of Engineers, that there's money is better invested to build a new hospital. But in the meantime, we still need to repair and fix what's leaking and what's, needs to be repaired because we have to continue operating.
Yeah, no matter what, because it's going to take more than a year or 2 years
It's going
to
to
build.
take 7 years to build a new hospital.
All right. Okay, thank you. Senator Therese, please.
Thank you very much, Mr. Chair. Lillian, thank you again for all your work, to you and your entire team for getting us through the very scary period and continuing to get us through today and through our reopening of businesses and what we're going to have to deal with, which has been unknown, and you have had to be very flexible. And so I know I've been trying to get exact answers from you since February, maybe what's the plan, and things have changed so much and so quickly, and it's really been trying for all of us, but I want to thank you and your team for really keeping us healthy, keeping us safe, and I know that GMH has really been deemed a COVID hospital. You've had to deal with patients, their families, the real trauma that they've been facing with the new rules, like not being able to visit. And it's really, we've received a lot of calls regarding that. I'm sure my colleagues have. It's traumatic, I think. And so, thank you for continuing to look at those policies and with as much compassion as possible for these families and for keeping us all safe. Thank you. As to the budget, okay, so overall, it looks to me like we appropriated $28 million for FY20, plus $10 million if you count that excess funds that we tried to give for capital improvement projects. The governor's budget request for 21 is $26 million, which is a little bit less than the $28 million, but your GMH's budget request is 29 million. So it's just about $1 million difference from the 2020 budget that was approved. So I want to thank you for keeping the expenses in check, I guess, that we can maintain a relatively similar level. None of the budgets, either the governor's nor your request, included, none of that 29 million is allocated for capital improvement projects.
Correct.
So I know you did attach at the the back of the budget document a list of capital improvement projects. I think that's been attached by the chairperson, the appropriations chair, to all the senators' packets today. So this is a list, and it's by department of what their needs are. Some of these are significant, in cost, over 300,000, and for all the different departments of the hospital. But again, those are not exactly budgeted for in the 29 request, right?
Correct.
All right, and so there is an urgent, I had written you a letter asking you to clarify. Last year you did the same. You made a list of CIP projects that were needed, and you itemized at least 3 of them as urgent.
Correct.
And so I asked you to give us an update. And of course, in the interim, Army Corps has come out with what they believed is urgent and needs to be
Yes.
repaired right away. So you've provided us, and I can provide to my colleagues as well, your answer regarding the Army Corps' list of projects and their implementation kind of estimate, the cost?
Yes.
And these are their cost estimates or yours?
No,
Yours.
we asked for their cost estimate, but
They
they
would-
weren't able to provide, because, COVID hit, and
Yeah.
so they weren't able to go back and provide that. So we did our own estimate.
Okay, great. And so we have a list of, these are called CIP list for Army Corps assessment implementation. And then you provide cost estimates. And there's a couple of these where you say will be funded out of GMHA operations funds. And that, very significantly for all of us, is this electronic health record upgrade project. So if you're funding it out of GMH operations funds, that means, is that because there was excess in FY20 that you were able to find this money and allocate it there? Or how did that, just maybe explain how the funding comes out of GMH operations funds?
Okay.
You were able to save some money to put it aside for these projects?
The EHR project is actually where we're almost transferring to a new company. So there isn't much upfront cost that we would need to invest. Because right now we're paying a monthly licensing fee of about $40,000. So when we move to the new one, we're going to pay a little bit more per month. But because it's like handing over to a new company, there are very little costs up front, except maybe a little bit for implementation and for training.
Okay, great. So when it says the contract term 5 years, and then it gives a cost estimate 2.6 million, that means over the 5 years, perhaps?
Yes.
Okay. And so then there's another category here on this list that talks about seeking funding source, right? I want to, first of all, let me backtrack just a little bit. So some of these have been funded by Department of Interior Capital Improvement Funds.
Yes.
And the HVAC system, I think the roof is listed as that also. And so I know we've talked a lot about those in our oversight hearings and throughout the year. So I'm glad to hear that. Can you just give us a time frame for those DOI-funded projects, for example, the HVAC and the roof repair? How long will it take to get that done?
For the HVAC, we already got approved for it. We're just now waiting for the authorization to activate or to access that fund. But the request that we had submitted got approved. We're just waiting now for the authorization.
Do you have an
And
estimate of time?
we have no time, it's out of our control. We want the money now and we need it now, but, we're just waiting now for the authorization for it to be released.
After the authorization, you'd still have to go and procure it, get a solicitation and all that, or you have it already procured or You already know where you're going to get it?
No, we don't know where we're going to get it, but we're going to need to find a contractor
Okay.
to then, get that project
All right.
started.
Okay,
So
what about the roof?
the roof? We have a contractor. We received some funding that we can use for the roof repair.
All right,
Originally, go ahead.
go ahead. DOI funding?
Last year, we had a price tag of like about $5 million for it. We were very fortunate that we found someone on island who can do the roof repair for less than the $5 million.
So what is your estimate now?
It's 1.5 million.
1.5.
Okay, 1.5, and when will that be done?
Again, we're just waiting. We're going to need to do the RFP process. We need to go through the RFP
This is
process.
DOI funds again, right? DOI?
It's not
Department-
DOI funds. It's going to be coming out of our operations.
Oh, okay. Your list says DOI funds. Hospital roof and envelope upgrade.
That's okay.
Okay, so that would, all right, great. So did nothing pan out from the insurance company on the roof?
I'm sorry, Senator?
Did you receive any funds from the insurance company for the roof?
No, sir. No, ma'am. We
None?
didn't. We appealed the decision. We were rejected.
All right, and then there are some categories for CIP projects where it says seeking funding source. For example, the main
Alternate.
electrical distribution system, 6.5 million, seeking funding source. It says construction schedule contract 2 years. What are your plans?
Which one is that, Senator?
This one, I'm now asking about the electrical distribution system.
Okay, right. The first one.
Yeah, we've been talking about this for years now.
Absolutely. We were very concerned about it. But again, we're very fortunate that the Guam Power Authority has been helping us, and they've been doing some preventive maintenance on it. So, we're not so concerned about it, but it does need to be, and, perhaps because we're going to be building a new hospital, maybe we don't need to, construct another one, or, and just continue with the Guam Power Authorities, their expertise to come and maintain, do preventive maintenance, doing their infrared inspection. And as long as it's operating well and functioning well, we may need to just continue it until the new hospital is built.
And that is being kind of sworn to by GPA, or Army Corps agrees that that's okay?
No, we didn't talk to the Army Corps about it, that was going to be okay, but that was one of their recommendations, was to
Continue with
fix
GPA?
it and relocate
No,
it.
they recommended that it be fixed or replaced, right?
They
And-
recommended that we move it away from the water,
Okay.
the water tank.
All right. So you're thinking not to do that? You're going to just keep monitoring?
We'll revisit that, and
All
we'll,
right.
again, get the guidance of the GPA. They're the experts on that.
All right. So again, the projects that are funded out of operations funds, I guess, are those from lapses during FY20 that you had in operations?
Yes, if we have extra cash, then we will, and then there's just some projects that are just critical that have to be done, and we just need to find the cash, so we may have to give up other purchases or other contracts in order to get these. It's about prioritizing, really.
All right. And then the overtime request for this 21 is less than what was requested last year by about 1.6 million. Can you just explain how you're going to
Just
reduce?
looking at the trend in how much we've been spending on overtime, I reduced it because, of course, when the divisions submit their budgets, they're putting in numbers that they feel they need. But when we're looking historically at the numbers and looking at ways to cut the budget, it looked like we didn't really need that much overtime allocated
Okay.
anyway.
Well, that's good news.
Well, and we also looked at the on-call pay program, and we discovered that there was quite a bit of on-call hours that, the staff were putting in when it wasn't necessary.
Oh.
So we've made those adjustments, and we really cut back on, we were expending close to $1 million on just on-call pay alone. But when we really did a deep dive into it, we discovered that there was unnecessary on-call hours. And so that helped cut back on the overtime. In addition to, we've recruited more respiratory therapists we've recruited more registered nurses, and so that has helped also curtail some of that overtime.
Excellent. Good news. Thank you. And then your medical and dental insurance was increased by $758,000. Can you just give us a brief explanation for that?
With the medical and dental is funded by the staffing, how much we have on the staffing pattern, whether there are vacancies or not. So since most of our vacancies are all funded, we had to fund also the benefit side of it, which included the medical and the dental.
For vacancies, you're saying that you filled?
Yes.
That's
Right.
why
That may be filled.
That may
They
be
have
filled.
to be
Okay.
budgeted, yeah.
Right.
All right. And then I'm very glad to hear, my next question was about DOC. So you've received payments from DOC? Are you up
Yes.
to date with the payments?
No, they're a little behind.
They're still behind?
Yeah, plus the prior years, they haven't paid.
Right.
Oh, no.
Primarily for the inpatient. When inmates are admitted into the hospital, that's where they fall short in paying those bills. It goes back to 2013. They owe us money, but we're not going to get that. We know that. But
I know you've been going back and forth trying to get that, and that was what impacted GMH's ability to pay its withholding taxes.
Yes.
But I heard from you today that you've paid off the
Yes,
rest
ma'am.
of the liability for withholding. Thank you. And that the DRT waived the penalties, so
Yes.
thank you to them also. And so we're clear moving forward. The employees are taking care of their withholding, and the taxes are good. You're
Correct.
just behind on, well, DLC is behind on sending what they owe for payment, and I guess we're looking at a potential of them not ever doing that. Is that what we're looking at?
Well, they paid in January the invoices. What's pending is from February to May,
May.
which is about $818,000 for the clinic.
So they're keeping
services.
current on the current
Yes,
bill-
the current
invoices.
is-
Great.
yeah.
Okay, that's good news, because, all right. During one of the board meetings, you talked about this, still being owed by certain insurance companies. For example, Take Care owed 13 million. I think that was in the news.
17 million.
Okay.
17 million, Senator.
And other companies owed. What is the status now of your collections from insurance companies?
From all the insurance companies, primarily they're up to date. They're paying, Aetna's picking
Aetna's
up.
they're getting better. Our big problem is really Take Care.
What is the status of that 13 million or 17?
17 million, they haven't made the payment.
Still pending?
They proffered a, they want to do a third-party independent audit, and they will pay for it to see really what the facts are, because they keep claiming that we owe them $6.3 million of that $9 million that they paid to the hospital in 2017 of May for claims prior to 2017. But, in our view, it was a settlement because they agreed to that amount. They made the payment for that amount, and so therefore it's a settlement.
I see.
But they don't think so. They think that it's a credit that we owe them. So that's one thing that we're trying to resolve. In the meantime, they haven't been paying what we've been submitting. And
Okay.
so the individuals who subscribe to that product, when they come into the hospital, we accept them as self-pay, and then, they make payment arrangements. They go to Take Care, and, it's interesting that Take Care, they make the payment because it's an out-of-network. They're no longer considered in-network. So they make the payment, for those claims that those individuals, and, we try and negotiate, but again, what I've said to them is that these subscribers bought your product. They pay, they continue to pay for your product. They have a legal obligation to then pay for the services that these individuals, subscribe to when they come into the hospital. To me, that's a simple business practice.
Are you refusing Take Care insurance right now? Is that why you say they're self-pay?
They're self-pay.
For current use? I know you have a dispute for past, right? Invoices, past billing, but for current, you're denying Take Care right now?
They haven't paid.
If the member walks in to GMH, we won't refuse service, but we treat them as a self-pay patient.
Does that answer your question, or?
Yes, I thought that you had resolved that you were going to, otherwise, that you were going to accept current patients under current contracts and take care of that past billing issues with
There's no
Take
contract
Care.
with Take Care.
No contract.
No current contract, and so
You have no
therefore,
current.
those
Okay.
individuals who subscribe to Take Care come in as self-pay.
All right. The differential pay that, I'm asking this because we did receive calls from, I must be employees at the hospital, several during the pandemic. I think I sent you some of these messages, but we still continue to receive calls that they think the pandemic differential pay was not fairly applied. Like not, only some of the employees at the hospital were getting the 25 versus the 15 versus the 10%. If you could just speak to that?
Sure, absolutely. According to the executive order, category 1, the 25% describes it as anybody who's performing his or her duties in direct contact with an individual who has COVID infection. And so therefore, those are the nurses, those are the respiratory therapists, the laboratory people, x-ray people who are in direct contact with a COVID infected individual, or even a PY that comes into ER. So those are the category of individuals who get the 25%. The 15% are then those who are incidentally performing their duties, to a reasonably suspected COVID individual. They get the 15%. The 10% expired June 5th, so nobody else, those administrative staff who were getting the 10%, such as myself, or not myself, but the administrative staff, because I didn't get the COVID differential. But the administrative staff who are in the administration office, they're not at high-risk exposure to any of those individuals with COVID infection, so they were getting 10%. It expired June 5th, so no more, they don't get any of that 10%. But the 15 and the 25% we continue to pay for those who meet the criteria of either direct exposure or incidental exposure. And that's how we're applying it. It may not have been consistently applied across the board because the timekeepers and the division managers, they have a different interpretation. But that's how we had sent out the message that the 15% and the 25% continues until...
Have you entertained complaints or kind of like appeals as to that type of application by the managers?
Yes, in fact, we had a meeting yesterday, but a lot of the complaints are in the clinical area, like the professional support services, the radiology, the respiratory. They had a meeting with with Dr. Ogden, who oversees professional support. They had a meeting and they were discussing that. But what we discovered was that somebody says, well, I walked to the ER. Okay, you walked to the ER. Did you perform duties indirect with a patient who has COVID or suspected COVID? If you didn't, you're just walking by, you're not going to get 25%. You didn't perform any duties. You just walked by. That, to me, is not justified to be paid the 25%. Just because you're walking to ER, you didn't perform the duties with that patient. So, okay, you don't get the 25%. But yes, there's some arguments from people who claim that they went to ER. We clarified that. And so, yes, we're trying to really, be practical about it and be prudent in how we then compensate the employees. Other agencies, how they do it, that's their call.
I suspect that's part of where the resentment comes from. Maybe they're looking at other agencies who are maybe at less risk and thinking, I'm
Okay.
here at the hospital, I'm at higher risk compared to them. And
All of us are
all
high
right.
risk.
As long as it's, I wanted to ensure that policies coming from you as the administrator and appeals are being entertained if necessary.
And we are listening to their issues, and
Okay.
we're trying to help them understand, the intent of that COVID differential pay.
All
Because
right.
yes, they're risking their lives when they are in direct contact with the patient. So therefore, they deserve that 25%.
Okay, and are you still using the Attorney General's office for billing and collection, or if you hired private?
No, we're using the AG's office. Yeah, we're coordinating with them.
All right, and then I'm going to raise this again. This is just because these are being sent to us. So of course, I don't know if you saw this letter from Dr. Akimoto the other day. He's saying there are 800 essential workers at GMH, and he was praising them. But the staffing pattern shows 1,264 employees at GMH. I think he's, saying there are non-essential employees at GMH. And then I hear, I get messages complaining about political hires or nepotism or the PARI system hiring at GMH. But, for us here at the legislature, I'm not one to say, hey, I want the hospital clean, so I'm not going to tell you how to do your job and get rid of, 300 employees, but I do expect that you are, using your resources judiciously. And what would you say to these people who are complaining that there are too many employees at GMH?
Okay. And in what category are there too many employees?
I do not know. Yes, they make it a general allegation. Do you believe there are too many employees at GMH in any
No,
division?
ma'am. No, we're a 24/7 complex operation, and so therefore there aren't too many employees there. In fact, we're short.
That's been my understanding in my discussions with you, so I wanted to clarify that.
Okay.
All right. CMS, are we on good grounds with CMS currently?
Yes, ma'am. In fact, we requested for a waiver because of this COVID situation. We've had to move the SNU patients out of the skilled nursing facility, and then we've moved them out of the acute care facility to a temporary offsite because of their high vulnerability to the COVID. So we wanted to protect them, and so we moved them over to the Catholic Social Services a building, and so they're away from the potential exposure in the hospital. But we received a waiver before making that decision. We requested for a waiver, and they granted us that waiver. And we still have the conditional participation certification from Medicare.
Okay, great. And no outstanding complaints or?
Well, they haven't been able to come out and do any surveys, and the last survey that they did was in August, primarily because of that leaky complaint on the contractual service of the laundry. And so we've addressed that. We do now have a different laundry service provider.
All right, and then finally, there, during the budget session, they added on a provision that GMH look at its fees, study its fees again, and submit to the legislature just a report as to whether fees do not match Medicare rates. Okay. And I think you did that in February.
Yes.
And, you said that you were hiring a consultant and that you were going to wait for a final report to come back. But in the interim, there were about 400 fees that you were citing that were already known to be below Medicare rates. Am I describing that correctly?
Yes.
These 400 fees, when I took a look at them, of course, this happened right before the COVID shutdown, but some of these fees are being proposed to be raised. Well, the highest one I found was by $7,800. That's one item. And so there were several of them. I marked all the ones above $1,000 increase. What would be the impact of this kind of fee increase, bringing it up to Medicare rates on patients? So those covered by Medicare, of course, would be covered.
Yes.
Those by Medicaid, would they be covered?
Yes.
And what about private insurance?
Those rates would also, because the rates apply to everybody.
Okay, so what about, we would pay more, for the government would pay more under MIP, of course.
Yes.
And then uninsured, what would be the effect, you think, of this?
They would also be impacted by the increase.
You would be needing or I guess there would be a greater amount of unpaid charges? Is that?
Possibly, yes.
Possibly, for the self-pay.
Yes.
And that would be something we would have to look at covering? Okay. Yeah. All right, well, it's good to know that it would be covered by insurance companies and all the others, at least. Okay. So in not getting these rates for many years, I guess, we've lost out on revenue?
Yes.
All right.
Yes.
All right, well, thank you again for all your work, and thank you, Mr. Chair, for allowing me that extensive questioning.
Yes, thank you, Senator Reese. I'd like to also recognize colleagues that have joined us. We have the speaker, Tina Munoz-Barnes is present. We have Senator Senator Regine Bisco-Lee. We have Senator Sabina Paris. We also have Senator Luis Muñoz and Senator Kelly Marsh. I will now ask the speaker, do you have any questions, ma'am?
Sijus Masi, Mr. Chair, yes, I do have a couple, and I'd like to thank you for giving me the opportunity to share with the hospital team, Dunklin Sijus Masi, for your presentation. It literally is, for me at least, in the years that I've been looking at and working with the hospital needs and desires, that you guys are trying to be really frugal, and knowing that you have your priorities set as it relates to the direct patient care and also the indirect patient care, and literally looking at the breakdowns and the needs of the hospital running 24/7. I have to say thank you. I see that there are a lot of streamlining that you guys have done. One that comes to mind, though, that you had mentioned earlier, and maybe you can help me answer this one before I get into the federal funds component, is you talked about the 4.5 Medicare advance payment and that you would be start to paying back in August. Can you reinstate that? Because if we're getting advance, wouldn't it just be minus what the actual receivables would be coming in from that? But you said something to the effect that you were going to pay it back in August. Start paying it back.
Start paying it back in August, yes, according to the program.
So the program is based on Medicare and the fees that are billed for Medicare for the services that are received by the patients. Usually it's Medicare who gives the hospital the money.
Right.
You got an advance of that.
Right.
So you would have to pay it back?
Yes, because it's an advance. So when the pandemic hit, they realized that hospitals would need quick cash infusion. So CMS came up with this program offering an advance for money. So we took advantage of it because there was a timeline. We ended up getting 4.5 million, and the
Right.
conditions were that we would have to start paying it back in August, and they'll give us a year to pay it back, but they'll just be deducting it from the remittances
Okay, yeah,
that they
so it
give
would be
us.
like an offset, right? Okay. So you wouldn't have to take the cash and pay it back?
Oh,
It
no,
would
no, no.
just-
They'll offset
Okay,
it. Yeah,
I just
okay.
wanted to make sure that I understood that clearly.
Yeah.
Thank you
Right.
very much. And in light of the COVID pandemic, what is the status of providing all of our hospital workers with the necessary PPEs? And how are we ensuring that they are safe? They keep us safe, but you keep us safe. So,
Right, we keep them safe,
Yeah.
and so yes, we provide them with the full PPE garment and the mask and everything when they're dealing directly with the COVID patient, especially if they're helping the doctor intubate or give aerosolized treatment. So they're full gown, and they're taught how to decontaminate before they leave that patient room. And so, yes, the PPEs, we haven't run out of the PPEs. We have resorted to alternate types of PPEs like the N95, and then they go through the fit testing because there's different types of N95 mask, and so it depends on your reaction on how it fits on your face, the configuration of your face. That's what that fit testing is for. And so we have different kinds of N95 masks, and we have a supply of that. We've gotten a lot of donations from different entities, from the clinics, from the doctors, and from other organizations, you know, including the Football Association. They got us some gowns, and so there's been quite a bit of donations from the community. And, you know, we continue to also procure for our own supply to keep up, because the burn rate, especially when you're dealing, a lot of staff are dealing in the ER with all these patients, you burn up a lot of your supplies, and so you need to replenish that. So we are keeping up. There hasn't been a time where we ran out of PPEs. The second layer of protecting the employees is that we've provided them an accommodation, a lodging, away from their home so that they don't go straight home to then possibly contaminate their family. They go through the decon process before leaving the area, they're then transported to a hotel lodging so that they stay there rather than going straight to their home. So that's the second layer of protection to keep them safe.
So has the hospital compiled a list or a data of all the donations that have come in from the nonprofit organizations or other,
Yes,
I
ma'am.
understand other governments have been able to help out?
Yes, ma'am. And we sent out thank you letters to many of them, and we're still doing some thank you letters also.
Do we know a dollar amount assessment of the donations that have been
Not right
provided?
off the bat.
I don't think they're dollar, some of them do have a dollar amount attached to it, but not all of them do.
Right.
But
Because we don't know how much they spend on
Yeah.
those PPEs.
But,
so-
and you're
It's a
still,
lot.
and you're still accepting
Yes.
donations as they come?
Absolutely. Yeah,
Oh, great.
absolutely.
Yes.
Mhm.
Good,
We even
good.
get from Taiwan.
yeah.
Okay, good to hear. Has the hospital seen an increase or decrease of hospital admissions during this pandemic? And how is the department deploying its resources differently to address the community needs?
During the peak of the pandemic, where we were getting quite a bit of admissions and positive, COVID cases, the census went down because we're the COVID hospital. And so non-COVID patients were going to GRMC. They were helping us decompress so that we can continue to expand Care 3 unit, that's our 4th floor. We wanted to then make sure that in order for us to accept the influx, we needed to just focus on those COVID patients, and GRMC focused on the non-COVID. And so that was one way to accommodate handling the COVID cases. Now that the census has kind of slowed down in terms of COVID patients, the non-COVID has picked up. People who are not infected, because they've been
patients.
staying home, they haven't had follow-up visits with their doctors, and they may have run out of medications. So now their medical conditions need medical attention, even to the point of hospitalization. So we've increased. We've been running now 120. This morning it was 138 patients who are non-COVID. They're medical, telemetry, ICU, surgical, med-surg kinds of conditions. And so that side of the house, non-COVID, has picked up.
And we still have the plan in place for any potential spikes that may occur with?
Yes.
We have the Care 1, which has 5 beds. Care
Right.
2 has 5 beds, and it has the capability of being an ICU level of care. We're trying to also modify it so we can do hemodialysis in that Care 2. We have the 4th floor pediatrics that we converted as a Care 3, has 17 beds. We're looking at the telemetry unit, converting that to a Care 4 for all COVID patients who need cardiac monitoring. So those are the plans that we're trying to make sure we have in place if in case we have a surge. We still have the SNF facility that we're also trying to design a plan to make it an overflow for those individuals who come from the acute hospital. They still need to continue to be in isolation and under medical follow-up and monitoring. That's what it is. But at the same time, we're going to make it switch ready so that if their conditions worsen, they become acutely ill, critically ill, or need to be on a ventilator, we keep them there at that facility rather than transporting them back to the acute care in Tamuning. So those are the plans that we have in motion to then make sure we really are prepared for the next wave of COVID or next wave of an infection that may hit Guam.
Well, thank you so very much for that presentation and sharing that with the listening community and our colleagues. That brings me to my other question as it relates to the full CARES Act funding. I know that you shared a breakdown of having about 19.7 million, I think, or 19.6 million. I just want to ask, is the hospital still aggressively looking, based on the plans that you have today, and looking into the potential, making sure that we're ready for any spike if necessary, continuing to advocate and look for grant fundings as it relates to the CARES, the CARES funding that's still out there, and maybe even what will become to play as it relates to HEROES and all the other federal grant resources that we can probably tap into. Is the hospital still actively looking into those protocols.
Absolutely. Our team applied for the SCC certification. That, if we get that grant approved, I think it's something like $2 million, that will help us procure, more computer hardware and additional, types of communications and computer equipment and training. We also, telehealth, that can, help us with our capability that individuals don't have to come into the hospital. The doctors can do their assessment of the patient and interact with the patient virtually. So those are additional grants that we have applied for. We're looking into the grants for skilled nursing facilities.
Yes.
And so I have a team looking into that to see if we can access those funding sources for skilled nursing long-term care facility. So we continue to look into pots of funding
Yes.
sources. Yes.
And FEMA is also one we're exploring right now, the public assistance grants from FEMA to give us a lot of the equipment that we need.
Correct.
Oh, that's music to my ears.
Yeah.
And I just want to say thank you for all the hard work that you guys continue to do, especially as we know that our resources are getting really tight. We may be okay for the rest of the fiscal year 2020, but when we start looking at 2021 and forward and knowing that those resources may be like, fizzled out, it's just where do we go from here, and how do we make sure that we at least have the necessary equipment, the staff, and the programs that you have today, that we can be able to hold it tight and it will continue to run smoothly. And Mr. Chair, it brings me to just one last question as it relates to the 17 million that's still owned by one of the health insurance providers. That's a big chunk of change, if not more.
Yes.
And I'm hoping that you can at least share with me, have there been any communication with the Attorney General's office, and as far as seeking judicial remedies to move forward and trying to collect this sooner than later? Because this funding that's out there, this is not, I've been hearing this teeter around this month from the provider for quite a long time. Correct. So last year, I know it may not have been this high, but it's come right back up to this amount, and it's not fair when all the other insurance providers are paying their fair share. So
Well, it's not fair to the subscribers. They pay for the product.
right, which hurts
so,
them even
yeah.
more, because they and when the patients are out there and they immediately get denied, it's a hardship for them.
Absolutely.
And they have to suffer the consequences for something that they've already been paying
For. They bought the product.
to get
yeah.
that service provided to them. So has the Attorney General's office been working closely with you to seek the judicial remedies to get this intact?
We haven't yet gone to that level. We're trying to resolve it at our level with our legal counsel, their legal counsel, and so we're going to be setting up a meeting.
So do you even have a timeline that we can work with?
Hopefully next week, that when we meet, we can agree to an independent third-party audit, and so we'll take it from there.
Thank you very much. And Mr. Chair, thank you for giving me the opportunity to ask these simple questions, and I really do appreciate the work that you and your staff have done, especially being in the front lines, and I want to extend my please to all of the frontliners. GMH, like I said, works 24/7, and you do not and cannot refuse any patient that goes your way, and
Yeah.
I know that's not an easy mandate. So
But we have an awesome group of employees and
Thank you.
doctors.
Thank you, Mr. Chair.
And yes, Ms. Rapadas, you have awesome employees at GMH. There is no doubt in that. Senator Amanda Shelton, my vice chair.
Thank you very much, Mr. Chair. And yes, I echo those same sentiments. We thank all of the employees at GMH, your excellent staff there who are continuing to keep us safe and run the hospital for everyone on our island. So we're very, very thankful for that. I think the speaker and the chair of health touched on all of the big topics, the DOC, the insurance companies, the health information exchange that I had questions about. And I wanted to get clarity, though, on the June 5th date you said for the COVID differential pay. So can you explain that again about the 10% exposure and the cutoff date of June 5th?
Okay. The June 5th, the executive order came out that says the 10% category 3 expired. So 10% was not at all being given to those employees who are not really at high risk because they don't provide direct interaction or patient care, or that their duties are not incidentally exposing them to reasonably suspected individuals with COVID. And so that was what that category was for, 10%. It ended on June 5th.
Okay, thank you for that explanation. Just like the health chair, I received many messages and phone calls about that ending on that date from hospital employees who also feel that their exposure just from being in the hospital is still there. They are still at risk, and of course, I feel that concern for them as well. And but I know that you are making the decision with the mandate in front of you. So thank you very much for that. I wanted to know about the status of the elevators in the hospital. How are they? Are they
all working? They've
all
all been
working now?
repaired. See, the media doesn't want to do that story because it's not fun.
Okay, well,
Not
that's good to
exciting.
know.
But they're all working.
Okay, I had
They've
no...
been certified and commissioned. They've been inspected by Public Works and certified and commissioned. They're operating.
That's good to hear, and sometimes it's good to share the good news too,
Yeah.
right? And I was in the hospital a couple of weeks ago, and I had no problem riding the elevator, so I was very happy to see that. The boilers, I know that it was repaired, so everything now is in order, no issues with the boilers.
Yes, there are issues.
Okay.
The boiler number 2 that went down in September, that got repaired, but these are old boilers. They're more than 20 years old. They need to be replaced. And so we sent out an RFP for the boiler number 1 to be replaced. Unfortunately, the bidders, one of them is protesting the offerer that we selected. So we're going through that hurdle right now. So it's going to delay the process of getting that boiler replaced.
Okay, and I know in one of the last oversight hearings, we talked about the generators and how you put that on hold also, though you needed new generators. Is that something that's on the top of the list of needs now? Has anything changed, or are we still going to be okay putting that project on hold?
We had an RFP for it, and I can't recall what was happening with that, because it was a generator that was really, really needed to be replaced. We had 3 bidders.
I think their bids exceeded our costs.
Yeah.
And so we needed to rebid it. Yeah.
Okay, so you are in the process of that now. Okay, and I know the health chair did ask about the DOI funding for some capital improvements. So that amount of money, if I recall correctly, was something like $400,000 you received, or was that all expended?
For the DOI funding for which project was it?
I don't recall exactly which project, but I remember they were capital improvement projects that we spoke about in the last oversight hearing. So I just wanted to know if all of those projects, those funds.
HVAC, that's a project that I think is 3.5 million. And that we are going to be using DOI funds for that.
Sorry, I can't hear you.
The HVAC system.
Okay.
The heating, ventilation, air AC unit. That's the HVAC system.
Okay.
That's going to be from the funding of DOI, and I understand the price tag is about 3.5 million.
Yeah.
So I
Okay.
don't know if that's the project that you're talking about. That may be around 400.
Okay, yes, that could be it. So that's already done, that project.
We're
No.
trying to get that project going because it's the DOI funding, and I believe we do have, as I mentioned earlier, we got approved. We're just now waiting for the authorization to proceed for that HVAC funding.
Oh, okay, thank you very much for that.
3.5 million.
Okay, and then I was looking at your COVID-related expenses, and I don't see anything specific to equipment purchase. Well, did you purchase any big pieces of equipment during this time, and were those already reimbursed?
We had some equipment that was actually donated through the Volunteers Association. And then most of the major equipment we put on our list to request from FEMA.
Okay.
Things like x-ray machines and C-arms and
Okay, so those have
radiology.
not been received yet?
No.
You're waiting for them?
Yeah.
Okay, all right, thank you very much. I appreciate your time here today. I know you're all very busy at the hospital, and are happy to have these answers for the budget. Siduos Masi, Mr. Chair.
Thank you, Senator Amanda Schoen. Mr. Potts, I got a real simple question to ask you. Has your agency taken a look at maybe coming up with a hazardous pay program for GMH?
The which program? I'm sorry, I didn't
A
know.
hazardous pay, an adjustment to what GovGuam has? Because you do have some employees at GMH that will face, certain hazards that are not expected. Everybody that signs up to be a nurse don't expect to run into certain things. There's certain levels that I know that at GMH you deal with that they don't do it at Public Health. They don't do it at the Guam Police Department. That
Correct.
it's only at GMH. And I'm just curious has GMH considered to take a look at how the program is set up, how the hazardous pay is done in the personnel rules and regulation, and how it may be changed to be improved for your employees?
Sure. And we have tried that years ago. We applied for the hazardous pay for people in the emergency room because, people that come in, we don't know what infection they have. And it's been experienced where people with active tuberculosis, we don't know until we find out that their
Yes.
results come back and they've exposed other people. So that we have tried, but we got denied. We will try it again.
Okay. Well, what I'm going after, Mr. Potter, is that take a look at how the rules and regulation is written today, and if you'd like, you can submit a recommendation on how the law can change.
Okay.
Because sometimes you can ask DOA all you want, you're not going to get a good answer or an answer that would be in the best interest of GMH.
But that was many years ago, so it's time to revisit again. The only group of hospital employees that are getting the 10% hazardous pay are those over at the DOC. Because, all the DOC employees, they have that potential hazard of, the clients they serve. So because of those employees who are there on premise, they are exposed to that potential hazard, so they get the 10% hazardous pay.
Well, if you take a look at the rules
Yes, sir.
today and you
Okay.
send some recommendation my way, or to your oversight, or to all of us,
Okay.
I will take a look at it, and we'll look at every agency and see how it can be applied equally across the board. Okay?
We'll do that.
Mr. Chair,
Yes.
could you just also describe the special pay that nurses are receiving that work at the hospital only?
Sure. The 16% incentive differential pay for working in a hospital setting, that just kind of distinguishes the scope of practice that hospital nurses do compared to community health nurses, compared to school nurses, because
Yes.
they don't deal with trauma.
That's correct.
In the emergency room, these nurses have to really have those skills, critical thinking skills, that if a person comes in bleeding or with chest pain, they need to think quickly what to do. Compared to school nurses, they're dealing with a larger population with different needs. And so that's why we established that differential pay for hospital nursing only when they work. They go on vacation, they don't get that differential pay.
Got it? Okay, no, not when applicable. Okay, thank you. Now we'll be followed by Senator Tello Taidagui, and then we're going to walk down the aisle after Senator Luis Muñoz, and then Senator Kelly March Taitano, and so forth. Thank you.
Buenas,
Buenas.
Lillian. Good to
Buenas.
see you always, and Yuka as well. Thank you, Ms. Heshchanova, for being here today. And if there's anybody out in the hall, I just wanted to give a shout out to them and all your support staff in preparing your budget. Especially during a time, I had my office manager who had recently lost her mother, and I just wanted to thank you so much for all the kindness that your nurses showed to her and her daughters while she was there at GMH. I know it's very difficult at this time to allow family to be in the room, and they made some accommodations. This was recent, not like during the COVID time, but This is, of course, just recent. And I just wanted to thank you so much for that, because it's very difficult during a time of a family member who's sick and doesn't look like they're going to recover at all, that you allow that at least one family member to be there. It's so devastating during this whole COVID.
Yes.
One of the things I know that it's hard at the hospital is to not allow that family member to be there while that person is, very on the edge, And I just wanted to thank you guys so much, and your heart of all those nurses trying to be that family member during that difficult time. So truly, I'm tearing here. I want to thank you and the Guam Memorial Hospital for that. And Lillian, you mentioned that the task for, the building of the new hospital, which, I'm so excited. I've been pushing so hard for this, and as well as the oversight chair, and she asked many good questions about it. One of the questions, though, was that wasn't asked was, of course, the bill had passed into law that created a task force. And I do realize the circumstances and situations, but I know you, Lillian, you can do 6 things at one time. And I'm hoping you would add that 7th one, and to bring that task force together, to look at how we can prepare 5 to 7 years. I think we can do it a little bit faster than that. I really do. But of course, it's going to take the help and the cooperation of all the agencies. So please, look into beginning that task force to start up, to build a new hospital. It's not only the people of Guam that deserve it, Lillian, but it's all your staff that are there 24/7. It's there. They need to be able to feel safe working in an environment, a safe environment. And I'm just really happy the Army Corps of Engineers agreed that it would be best to just rebuild. And so if you can do that for me, I greatly appreciate it. The other thing that was mentioned, Ms. Hechanova, when you talked about the $1 million that was basically kind of a loan for the Medicare that was given, in your budget bill, since it is a loan, that means it has to be paid back. So is it incorporated in 2021 budget to pay that back?
No.
How will that work?
They're just going to take it out of whatever they're remitting to us for that payment. So we may get a payment every week from Medicare, so they're going to be drawing down from those remittances.
Okay, so
to pay
deducting
back.
it from there. So you've already incorporated that too, as far as any budget adjustments, or it's just a drawdown? It's not really incorporated.
It's just a drawdown, yeah. So.
Okay, that's good. The other one question I have too is with regards to during COVID. I know that the related expenses to COVID expenses that you provided for us, thank you so much. It's real nice and clean, by the way. I just wanted to comment. I really appreciate your presentation. It's spread apart enough so that we can really see the numbers, and I greatly appreciate that. But I was wondering, during COVID, we knew that Guam Memorial Hospital was the designated area for those who were infected. Now, you had individuals who had come to the Guam Memorial Hospital with no COVID signs, but then were sent to GMRC. Now, GMRC became the hospital to cover other conditions unrelated to COVID. Who pays for that bill? Is that going to be paid because they were going to GMH, and then, or those who were at GMH currently and then were moved to GMRC? Would you guys have to pay that, or how is that going to be reimbursed? How does that work with regards to the payment of those patients who were transferred from GMH to GMRC?
Those patients were discharged to GRMC, so they become the GRMC's patients.
Okay, so there's no cost incorporated with that at all that we have to, okay, so just wanted to make sure. Testing, I know there was quite a bit of concern about the type of testing going on at one with the swab, and this is my last question, Mr. Chair. Oh, he's gone anyway. So there is the swab testing, but is there also a blood test that you can take that's just as accurate?
The blood testing is a serology testing. It's not testing if you have the infection. It's testing if you have antibodies that your body developed to then fight the infection. So it's an indication that you may have had the COVID infection.
I see.
And that's what that serology testing is. We have the machine,
Yeah, I had a
and
couple.
we're still going through the validation process with Hawaii.
I see. I've had a couple people ask, they just don't want that swab up their nose, and they're wondering if...
It can be a painful.
I've heard people
is,
crying, and some person told me that their nose was bleeding afterwards, and was wondering if it's as simple as just taking a blood test instead of doing the swabbing, but no.
No,
It has
what
to
we
be-
have is the serology for antibodies.
see.
Not a blood test to see if you have the infection.
I see, I see.
Right.
Okay, well, that definitely, I'll let them know if they're not
Yeah.
listening
they can
already.
they can do a deep nasal pharyngeal swab, but they can also do a nasal. But we want to get to the deep one because that's where the organism, the virus,
I see.
you can capture the load of it,
Okay.
so that when it's analyzed, it can have a better, more accurate analysis of it, a result.
Thank you so much for that. And thank you, ladies. Again, I'm a great advocate for the hospital. And I'd like to give a shout out also to the Pink ladies who are there at the hospital that provide a lot of help for the nurses and the staff there, alleviating some of the job duties and giving comfort to your patients there as well, and all the other volunteers. But I know the Pink ladies play a very big part at Guam Memorial Hospital, and I just wanted to give a shout out to them as well.
Yes.
And thank you so much, ladies. Thank you.
Thank you, Senator Tydegui. Senator Munya?
Thank you, Madam Vice. Just a couple of questions. Again, thank you for being here. I could imagine that even though this is a daunting task to do budget, it's kind of a welcome break from the madness that you have seen in the last 3 to 4 months. So I'm sure you're happy to see us as much as we are you. I just, a couple of questions. Just, based on your presentation, it looks like COVID helped with GMH's finances. How long do you think this trend would last or could last, to just be comfortable?
Well, we're not getting any more money from the CARES Act. We don't see that coming forth. It will run out eventually, and the effects of our census being so low and our revenues, it's going to catch up to us eventually. Probably in 3 or 4 months when we start to bill and the collections won't come in because we won't be billing as much because there just
And we
wasn't
practically
very
go
many
back to normal
patients.
then, right?
Yeah.
So you're saying about 3 to 4 months
I
then?
think so. I thought it would be sooner, but it looks like because we got additional money, it will carry us a little bit further.
Okay. Well, let's hope we fix some of those loopholes, right? So that we don't go back into as deep as we were before. But unfortunately, or fortunately, with this unfortunate pandemic, we're able to, assist with some of our finances.
Yes.
So thank you for working on that. There are some hospitals in the U.S., like instead of buying computers and servers and software and spending money to operate them and maintain them, they're opting for cloud-based systems. Have you even considered maybe transitioning to a cloud-based system?
Yes.
Yes.
You have? Okay, great,
The new
great.
EHR system.
Great, that's wonderful because I
cloud-based.
know that it really helps, when they use these companies, it helps to, the internet, running the accounting and all the other billing functions, and I'm sure it'll help the hospital too as far as collections. And I know there's an annual fee that you have to pay for this cloud-based, but I'm sure it'll help us to be more efficient and maybe even save a whole lot of money. So that's great to hear that you are actually looking into the cloud-based system. So and that's really all I have for you because most of my questions have been answered. But again, thank you so much for all the work that you've been doing. I, like Senator Shelton, have been at the hospital to assist with some of the repairing of the N95 masks. And we know that there's thousands of masks there that can be used that just need a slight repair. So if you need any other help, please continue to reach out to us. We're here and we're willing to help you out. So thank you again very much.
Thank you. To your point with regards to, how this COVID is affecting us in terms of our revenue, it has affected us because we suspended elective surgeries. We suspended outpatient services such as physical therapy, the cardiac care clinic. And so we've opened up our outpatient and rehab, and that's going very well. It's now the elective surgeries that we're just kind of waiting because, we don't want to have all this influx of people coming into the hospital.
I would imagine there's a backlog for it,
it's going
right?
to increase. It's going to increase the traffic, but yes, there are backlog of surgeries
Okay.
that need to be done. So that will help us if we get going back into doing elective surgeries.
Okay, well, my prayers are for you all, and God bless you all for everything you do. Thank you.
Thank you.
Thank you, Senator Munoz. Senator Marsh-Titano.
Seduce Masi. And so I want to begin, of course, with saying Seduce Masi for being at the front line. I'm glad that we as a community have better learned how to identify a variety of types of heroes, especially and certainly those within the healthcare system. I think that's been an important thing for all of us to learn. And it's good to hear of the improved collections that you were discussing and some of the other progress that's happening, the DOI funding that's coming, and so forth. And the questioning's been pretty thorough. But what I want to do is just ask a couple of questions regarding some of the growth as our community is continuing to evolve and what may or may not be in the works in this upcoming year for the hospital. So we know that there is the military buildup. We're getting closer and closer to when they're aiming to have their fuller components here. And that means the population is going to be growing a bit over time. And so certainly some of them will be on base, but many of them live off base. Has there been any thought or discussion or movement in any way in looking at a possible increase for the hospital, since a lot of them will be off base, or perhaps they'll be off of base when something happens? Has that been any part of the discussion yet for the hospital to accommodate some of the thousands that are coming associated with the military buildup?
We haven't had the opportunity to sit and discuss that. We've had discussions with Admiral Minoni and the governor with regards to the COVID situation, but not for the influx or the buildup of the military. But definitely that is a concern because, they do have dependents who may not qualify to be serviced at the Naval Hospital or the Anderson Clinic. So we're going to need to, get to the table and discuss how we're going to address the influx and the buildup of the military personnel who will need probably, hospital services in the civilian.
That's good to hear. And it sounds like the discussions that you're having already, that those create a good foundation to be building on. And so that could be a natural growth of those discussions. And as far as you're aware, for the funds that are earmarked for this buildup, has anything been discussed? I know that we as a local government and the military in their way as well has tried to call upon the U.S. federal government in helping them understand that our infrastructure and our services are going to be heavily impacted. Has there been any discussion, as far as you know, about money coming our way that's going to help us in the healthcare services, the hospital specifically? Has there been any funding discussed related to the military buildup?
I haven't had the opportunity to do that. COVID put us to different lane here. And so, no ma'am, I haven't had any discussions, and I'm sure that there will be some discussions.
And again, I think that the discussions that you've been having will serve as that good foundation to continue building on it. The pathways are already there and so forth, so that as we continue to balance some of our more day-to-day activities,
Right.
that will perhaps be coming to the forefront. So, and then the other part of it is also looking at the compact, the treaties between the U.S. and our neighbors in Micronesia. So we've been hearing more recently that about 50% of those that leave those areas come to Guam. So with that, again, are those part of any discussions yet, or maybe something you're thinking about for the future that we are trying to help the U.S. understand the impact that their treaty is creating for us? I know that there are efforts to try to get better data and better statistics so that we can at least make our case stronger for asking for more appropriate reimbursement. Have some of those discussions included you when they're trying to improve their statistics and data gathering?
We've been asked for some data as far as, individuals who come from those islands and how they enter into our facility. So we've provided some of that data. But as far as actual discussions, being engaged in those discussions, I haven't been involved in it. I haven't engaged in it. But, definitely something that the hospital needs to be a part of. So, I welcome whatever invitation that, whoever's leading that discussion, I welcome the invitation, and I certainly will, I'd be glad to participate in that one. Because we do see quite a bit of, individuals from that population coming to the hospital.
So Duas Ma'asi for that, and I will definitely pass that along because that's something very important that our community is trying to do. I think they're starting off with education because education is able to gather a lot of data, and so I think they're starting off with that model. But I think as soon as possible, they do need to be including you. So thank you for
at the regional
that
level,
interest.
With the PIHOA, the Pacific Islands Health Officers Association, I've attended some of those meetings. The last meeting was in Palau that I attended because Guam Memorial Hospital, by virtue of our operations as a hospital, is a member of that PIHOA group. And so we were supposed to have a meeting this year, but COVID came, and so that got put aside. I'm sure there will be a continuing dialogue with that.
Well, I'll go ahead and limit it to there. Just that, like I said, I wanted to get an understanding of some of our growth, and of course, these are going to be things that need to have their foundation of discussion, and then they'll work their way into the budgets and make sure that it's part of those plans going forward. So, Duas Ma'asi for the answers that you've given.
Okay. Thank you.
Thank you. Senator Moylan, do you have any questions?
Thank you, Mr. Chairman. Thank you to the panel. Just a couple of questions going back to the CIP needs of the hospital. Recently, actually this month, the National Weather Service provided us some predictions on storms and tropical depressions and typhoons to experience. And of course, we're in Guam, we're all kind of ready for that. So in June through July, they're projecting 1 to 3 depressions, tropical depressions.
Right.
So a bunch of rain, right? From July to November, they're projecting 2 to 3 typhoons, and even a possible Category 4. So that's winds up to from 130 to 155 miles per hour. May not happen, but that's their jobs to project for us. Today, it's so darn hot, right? It's really dry. So our roof at the hospital is probably doing okay. And I understand you have the RP out there to work on that. And that's coming from general funds, right? But let's say if the storm is today, and worst case scenario, how would our hospital look if that roof was full of water?
It will leak.
And where would
Even
those,
just a regular rainy day, it leaks. Because the envelope of the hospital where those windows are, those are really, really old, and the seal is already pretty much corroded, so water comes through there.
explain to me how is that floor to floor? No. So if I,
Or even just, because, on the side windows, the water comes through for that second, third, and fourth floor.
so if I'm walking in the downstairs at the admission place, I recall seeing towels next to the
Damaged
windows.
linens, yes.
And that would be on every floor. You had to use your laundry to absorb the water. Would that water also come into the elevator shaft? Is that a situation?
It did, and that's why it damaged the elevators.
And that's the damage
why we had
caused
to
by it.
replace those elevators.
So the elevators work today, but if we get,
All four are working.
congratulations, that we just need to put an umbrella over where the elevators are then, right? Because
At the
basically,
top of the roof.
yeah. Did I see pictures in the news where it actually looked like it was raining inside the elevator? I mean, water is dripping down from the inside. Is that?
Yeah, and that's what happened. That's why we had to repair the walls of the elevator, the shafts, before we could put in the brand-new carriages. Because it's pointless to put in the brand-new carriages when there's still going to be leakage. It's going to damage those brand-new elevator carriages. And so that was the primer work, is to repair those leaks in those shafts.
Okay. With the projection of the storms, though, this doesn't mean that's a guarantee that the rain will not come through, right?
Because the roof is where it's leaking.
Because the roof leaks.
Yes.
So, back in September 14, we passed our budget, Public Law 3536, which appropriated for that fiscal year $10 million to go to the hospital for the capital improvement projects. It's been 8 months now, and here we are today talking about your budget again. And this body did recognize that we didn't get you that money. So in February 4th, your oversight chair was instrumental in passing public law, or getting Public Law 3573, which again reiterated the need for that money to get to GMH. But that became public law because it lapsed into law. And justification, or the reason in the lapse in the letter, it was recommended that GITA consider other financial options. You explained earlier that the $10 million is still not appropriated to GMH.
We haven't received it.
Okay. Have you heard anything from GITA of other financial options to give the hospital GMH money?
No, sir, we haven't received any communication from GITA.
Okay. The legislature, of course, is really wanting, or I think my colleagues, we want to help you guys out. And you explained that the possibility, it's great if we have a new hospital, whether it take 5 years on an expedited process or 7 years. But in the meantime, we have our tropical depressions and tropical storms. Maybe the next one would be called Typhoon Kovat. That's how quickly these things come, right? And we had to be prepared right away. So there's other measures out there. Maybe we need some public-private partnership to expedite this process. The long-term goal, it will be wonderful, the projection, but we got to focus on today. So I'm hoping we can get some measures that can help you out with some public-private partnerships in the meantime. Because I hate for our new elevators are running great to all of a sudden get short-circuited and you don't even want to press the button because you got to open your umbrella inside the elevator on this next tropical depression or super typhoon. So I'll continue to work with you on that. I'm looking forward to that. And thank you for all your hard work you've been doing. Thank you very much. Thank you, Mr. Chairman.
Thank you.
Thank you, Senator Moylan. Senator Mary Torres.
Thank you, Mr. Chair. Yukon Lillian, it's always good to see you. I just want to comment, first of all, that this budget presentation is very unlike other budget presentations. I note, for example, that most budget presentations of the past came with great alarm about how GMH is severely underfunded, and a lot of that had to do with the 3 M's, we were always told, the Medicaid, Medicare, and MIPs, and that the funding levels or reimbursement levels were something like a quarter to every dollar or some disproportionate amount. But Yuka, I just want to ask you, with regard to the 3 M's, in your fiscal year 2019 payer mix slide, you showed that the 3 M's make up about 58% of the payer mix for 2019. And then in the slide right before that, you did a composition of collections and you showed how there's a huge increase in collections for Medicare, Medicaid, and MP from 2019 May to 2020 May. We know that a lot of that had to do with the lifting of the caps and adjustment of the rates, but the question that I have to you is, can you explain, for example, why the 3 M's are not the topic of this budget presentation, what has changed, and also can we anticipate that going forward, the 3 M's is not going to be the reason that GMH is always severely underfunded? Can you just comment on that? Because I think that's an important difference between this budget and every other budget I've ever attended.
The rebasing that happened last year really helped our reimbursement rate. It's still below our actual costs, our actual discharge rate, but it did help a lot. So we are still not getting 100% of what we bill the 3 M's. They pay us on a per diem basis for inpatients, so right now that amount is almost $1,700 a day. So depending on if we have a patient that's really very ill and every day incurring a lot of expenses, maybe they're in ICU and having a lot of procedures and what have you, we're still only going to get paid that flat rate for that day. So the rebasing brought us years ahead to 2014 rates. What should happen is we need to rebase to a more current year to really meet our actual costs.
Right, and sometimes that could be double what 1,700.
Yes.
Say if they were in the emergency room. Or,
Yes.
Yes. Okay.
Yes. So just generally speaking, very generally, if we were to bill Medicare and Medicaid, the 3 M's, X amount, we only get about 50% of that in payment, sometimes even less. But generally, it's about 40 to 50% that we get back. So that's why if you look on that slide with the, right under, next to the payer mix, we have something called a contractual adjustment. That is the amount that has to be adjusted for those bills because we won't collect payment. They will not pay it. So it's a huge amount.
Yes.
That we have to, not write off, but it's adjusting the bills based on what we're going to get paid.
And that amount before was about 1,000, right, or 1,100? So
Yes.
Yes, okay.
So now we're up to almost 1,700.
Now, the reason that I brought that up is at one of the budget hearings for public health, the MIP question came up, or it was raised by me, and one of the explanations about MIP and whether we're sufficiently accounting for that given the COVID conditions, unemployment conditions, the fact that there'll be more people uninsured or on self-pay, which would affect the MIP numbers, we think. The explanation that I got was, well, it's okay because we can bill it against Medicaid. But are you anticipating that going forward, post-COVID relief and CARES Act relief, that we should also anticipate that notwithstanding the rebasing, that the number of people relying on MIP to cover expenses with healthcare are going to jump. So I'm just trying to get a sense of how realistic we are about the needs going forward. And although we've made gains with getting more money reimbursed through the 3Ms, whether the need is going to increase and offset that gain.
Part of the CARES Act, there is a provision for the uninsured. So the uninsured will be covered for any COVID testing or even COVID-related medical treatment. So that is supposed to be covered under the CARES Act if you are uninsured. Uninsured means that you don't qualify also for Medicaid. So those are people that usually probably exceed the threshold for income probably, so they don't have private insurance, but they don't qualify for Medicaid, so they become uninsured. So they will be covered under the provision of the CARES Act for the uninsured. As far as, and then the MIP, to my understanding, is just the locally funded sister, I guess, of the Medicaid program.
Correct.
We see a lot more people that qualify for the Medicaid part and on our side, so that's why we end up billing them a lot more and we receive a lot more money from the Medicaid. Yeah.
Okay. And is there any threat to our CMS certification, or has that been resolved?
There's no threat.
Okay,
We
so
haven't
we're fine
received
now.
anything. We
Okay.
submitted our plan of corrective action in response to the statement of deficiencies that they reported for the August survey, and so they accepted our plan of corrective action, and so we continue to be certified as a participant of CMS.
I just want to add in closing that I want to congratulate you on presenting a budget presentation that is a lot more hopeful than I've ever seen in the past, and kudos to all of you, and we're here to support you, so we hope that we can gain more ground in terms of the rebasing or the rate that we can realize from the Medicaid and Medicare in the future. So congratulations to you and Mrs. Uesmasi for this presentation.
Thank you.
Thank you.
Thank you, Senator Torres. Senator Lee, you have any questions, ma'am?
Yes, Masi, Mr. Chair, and thank you very much, Administrator Posadas and Ms. Yuka, for being here this morning to answer all our questions. I do want to take a moment and just thank everyone who's part of the GMH team and also their families for really shouldering a very heavy burden throughout this entire COVID pandemic. Also to GMH VA and all the community supporters who brought food and contributed supplies, and we just want to shout out everybody for really helping to take care of our only public hospital. I'm glad that you were able to answer some of the questions that I had about electronic health records, about CMS, some concerns about the staffing pattern, also concerned about the CARES Act funding running out. And I'm really hopeful that elective surgeries and other potential revenue streams opening up when it's safe to do so will help us to just get up and running. So I want to thank you in advance for really trying to prioritize GMH's needs and keep us up and running. I also want to thank my colleague, Senator Torres, for her comments about the payer mix. Many of us this is not our first budget rodeo, we've heard so much about the 3Ms, so I'm really grateful for the rebasing, as you mentioned, Yuka, but also for your efforts, your focus on collections, because I think that's really going to help us to make sure that GMH is sustainable in the long term. I wanted to ask you, the promised labor and delivery award is something that I'm sure that many people are interested in. Can you provide an update on this project and whether any further legislative action is needed to get this project started as soon as it's responsible to do so, given our COVID situation?
Mm-hmm. That project is kind of on hold right now. One of it is because of COVID. But the other thing is the financing option that we need to find. We need to do an RFP for a financial institution who will then, grant an upfront financing, because the USDA doesn't just cover upfront we have to have first a banking institution, a financial institution who will cover the cost up front. And so we haven't moved forward with that. We can revisit it again and see, if we really need to continue moving forward with it, because here, is the option of a new hospital being built. So if we're going to expend all that money to upgrade and modernize the MCH area as it was originally designed, I'm not sure that really we want to expend all that money and then find some funding source again for a new hospital. So we may just have to, wait it out and let the new hospital be the modernized maternal child health area.
Well, we'll be certainly keeping a close eye on that and trying to figure out what the timeline is and what makes the most sense for everybody. But we're fortunate enough to welcome a brand new member into our family last week. So my sister had a baby boy, and
Congratulations.
Yes, thank you so much. He's adorable. But the nurses at GMH really helped to make this a reality. My sister is a labor and delivery nurse, so she knows exactly what needs to happen, and I'm just very concerned that it's not as efficient as it really needs to be for our community. So I'll get back with you on that one. Okay. I wanted to talk a little bit about salaries between your current budget and your request for next year, which is set to rise by some $1.5 million. And I know you kind of touched on this earlier. Can you detail for the committee what critical positions will be filled with this requested increase, and maybe just give us a sense how this increase will improve patient care or improve your revenue stream?
Okay, sure. We're still in need of staff nurses, particularly in the specialty care area, such as the emergency room, particularly in the ICU, because we have a 14-bed capacity. But because of our staffing for nurses who have the critical care background, that's where we can't really accommodate the 14 beds.
So Lillian, is this tied into the $990,000 that you're spending on for travel nurses, or is this something separate?
We're utilizing the travel nurses because they have the experience of being ER or critical care nurses. It's hard to find experienced critical care nurses locally. So yes, we bring them in. We're trying to, taper the reliance of those travel nurses. So we're looking at, having a program that will train more nurses who are interested in critical care, and so we can just, grow our own critical care nurses.
So this is a training program that you're going to be working with UOG and GCC to accomplish, or?
Well, the UOG, they come, and the GCC, they come to the hospital to do their clinicals.
Right.
So they're mentored, and that's where they get experience. But in the ICU, we really need to have nurses who are experienced already. Because, once we get them oriented, they're on their own to provide the care for those critical care patients. New nurses, new graduates from UOG, we do welcome them in there, because the advantage is then, we influence them. They're easily influenced. They're new graduates, but they're novice nurses.
Right.
They really need to have a close one-to-one critical care nurse to work with them, but it's an investment.
Absolutely.
Yeah,
and I'm
it's
so
an
proud of our
investment.
local nurses, especially the ones out of UOG and their long track record of passing all their exams. And I really feel like the local homegrown nurses, they understand our community so much better. And with that experience, it'll just be so much better for everybody. There is a spending cut that stood out to me, Lillian, and that's the projected decrease in GMH paid training of about $785,000 across your divisions. So what training opportunities are slated to be lost next year? And would this cut affect any employee who's required to obtain CEUs or continuing education credits or personal certifications?
Mm-hmm. Those are part of the training that we want to have ongoing.
Okay.
Leadership is another one that we want people to,
I'm seeing a decrease, so I'm wondering what's being cut and what.
We did apply for a grant with Department of Interior, the Technical Assistance Program. We just submitted that, I think it was right before
COVID.
the pandemic. That's about $2 million that we requested for training across all the divisions in the hospital. from-
Excellent. And when will you be hearing back about that
That's
deal?
what we don't know, we just wait. Yeah.
We're
Okay.
following every week.
Yeah,
Okay, great. Well, I mean, if we can help to follow up with you, we'd be happy to do that. Those are all of the questions that I have. I think a lot of my colleagues have asked some really great questions this morning, but I do want to thank you so much for your time and really just give a huge shout out to the GMH team. I received a bunch of messages during the COVID pandemic from many of your team members, and I know some of them had challenges getting to work in terms of making sure that they had childcare, making sure that all of these issues were taken care of. So I appreciate you guys really trying to be on top of it and supporting your team who turns around and supports us. So thank you very much for all the work you do. I appreciate it. Thank you, Mr. Chair.
Thank you, Senator Lee. Senator Paris, do you have any questions, ma'am?
Yes, Mr. Chair, and thank you. Good morning, Ms.
morning.
Posadas and Ms. Hechanova. Thank you for all your efforts in keeping us safe during this pandemic and in addressing the needs of our community. I'm so really grateful for that. Just a couple questions. So with regards to the CARES funding, what kind of improvements have been made to the hospital, and would that affect a reduction perhaps in requesting of funds this time around?
We actually did decrease a little bit on our minor equipment because we were taking advantage of the funds that we did receive from the CARES funding. We have about $5 million that coming from the Governor's CARES Act to do a couple of big projects that we haven't started yet, but we will. As far as equipment, we purchased maybe some smaller equipment, but the real major equipment with the X-ray machines and radiology type equipment, those are the ones that we're requesting that FEMA can help us purchase and pay for. FEMA will pay 75% through their public assistance program, and then GMH will be responsible for the 25%. So we're actually working with the FEMA representative right now. I think this afternoon our team is meeting with him to go over our listing to see what would qualify and what our chances are of getting those equipment.
Okay, thank you. In regards to building capacity, so this is some of the issues that we're concerned about. With the reopening of businesses, has there been an increase in GMH to take on greater amounts potentially of hospitalized patients? Is there an increase in our capacity to address any kind of surge?
Mm-hmm. We have increased our capacity. Like I said, we've converted the Care 1 unit, which used to be the urgent care, into a COVID area. The Care 2, which used to be the specialty out clinic, we converted that to a Care 2 COVID, and that's 5 beds there, 5 in Care 1. Then the 4th floor pediatric, we've converted that to a Care 3, strictly for COVID cases. Again, that's a 17-bed. On the 3rd floor telemetry, which is a 25, 26 bed capacity, we're looking to convert that to a Care 4. Again, strictly for COVID, and it does have the central cardiac monitoring capability. We have also the SNF, which is a 60-bed facility. So we're looking to convert that into a step down for COVID isolation. At the same time, getting it ready to just turn the switch on, that if a patient crashes or a condition deteriorates, then we can just contain them there. And if they need to be on a ventilator, we'll put them on a ventilator. So structurally and facility-wise, we have been working to increase the capacity. Our challenges are staffing. We can have the beds, all the beds that we want. We can increase, the capacity, the physical capacity. But if we don't have the human resources to take care of these patients, that's a challenge. And so we're looking to see how we can address that challenge. We're working with a team that possibly maybe the DMAT, the medical team that can come from off island. Maybe they can be activated and deployed to help us. But we're working with the military. We have to work with the military on that one.
So with this budget, what is the capacity that would this address, this current budget? So if you can just do the quick calculation that you you're mentioning a couple beds. So what is the capacity currently for this
No,
budget?
this would just keep us at whatever we're at right now. It's not increasing any capacity at all,
Right.
yeah,
In the budget.
in the budget, no.
So a total of how many beds
We
for
are
COVID
How
related?
many beds?
What was that?
160 beds?
How many beds? 60 at the
We have
SNF.
60 at SNF, but only 20 are staffed.
Right, we
Yeah.
can only staff 20.
Okay. Sorry. Oops. Okay, the other thing is as far as receivables, what is the total account receivables to date?
May, we have that.
We are at about 40, I think 48 million net. Yeah.
Okay. And what is the breakdown of the receivables? Is that Medicare, Medicaid?
It's all across. We have the 3 M's, the insurance companies,
Self-pay.
and the self-pays.
Okay. Yeah, I recall, maybe a year ago, this is such a great progress I see.
48.
So thank you for that.
Yeah.
In regards to reimbursement of Medicare, I guess you did answer that earlier. Do you have any prior year obligations?
I don't think so. Our payables are really good. So right now with the cash that's coming in, we're really cleaning up our 90 to 120 days, and it's almost completely clean. So we should not have any prior year, if anything, 60 to 90 days.
Okay, great. Thank you, Mr. Chair. Thank you for answering my questions.
Thank you, my colleagues, for asking all the questions. I would ask the Oversight Chair, do you have one or two follow-up questions you wanted to follow up with Ms. Rapadas?
Just one. Thank you so much, Mr. Chair. Thank you again for everything and the progress. But on this list that you attached to your budget that's called Listing of Capital Requests, there's a total of about 30-some million.
Correct.
38 million on this. And then there's about 8.45 on the Army Corps assessment list that you provided that says
33.
seeking funding sources. I just want to know, so for this capital list, I mean, it goes from things from anesthesia machines, specialized beds, ER supplies, EKGs. Some look very vital, some, look like a cardiac, equipment. So how do you intend for us to look at this? It was not included in your budget request. You're not requesting money to fund this, but they're a listing of what looks to me critical supplies. So are they critical for patient care? Or is this just a wish list, or how do you want us to look at this list?
Well, we have those equipment already that we are utilizing, but they are getting old and they need to be replaced. So definitely we'd like to have some funding for it. And so, I know we're kind of being conservative, but we're dealing with what we have, and depending on what our revenues that we collect, then we will use those funding. We're looking to have a revenue cycle management team come to help us how we can fully capture, the claims and the services that we provide, so we don't write them off as lost revenue. We want to make sure we capture as much revenue as we possibly can.
So your board is, you all are, your management team and your board are okay with, you're going to fund these as revenue becomes available to you. Is that what you're saying?
Yes. Yes.
All right. Okay, wanted to clarify that. Thank you very much, Mr. Chair. Thank you again.
Thank you, Senator Therese. Ms. Rapadas, 2 issues. Number 1, you have solar up at GMH?
Solar?
Solar? Are you going to consider trying to get solar so you can find a way to reduce it? I mean, we can call GP and ask them if they can give you a gift for 1 year, at least one year, break. Maybe you can catch up on some things, but I don't know what the chances are, but we'll ask. I'll ask it.
Okay.
The next one is because you're not getting anything with the insurance, with the damage, and GMH has been paying this I'm just curious, are you still with the same insurance company, or?
We RFP out, and the only one responder.
Okay, I'm only concerned is that there's got to be a mechanism in place that it's like myself at my house. If they don't cover it after one time I clean, no matter what, I'm going to somebody else. Okay, and I just don't want you to, because I'm not too sure exactly how much do you pay a month in insurance coverage for?
About 45,000.
How much? 45?
45,000.
Okay. Well, just take a look at it and work it from there, all right?
We try, we have to go through the procurement process, and so we have to go through the RFP.
Right. Okay, I'm just gonna ask you to please take a look at it, and if they can't cover you, you need to move on. Go to somebody else. Or be self-insured. Maybe that's the method we need to go.
Yeah.
We tried that last term. The committee will conclude the budget hearing with the Guam Memorial Hospital on Bill 282-35. Committee will continue to receive testimony. Please address your written testimony to the Committee on General Government Operation, Appropriation, and Housing, and submit it via email to Senator Joe S. Augustine@gmail.com. Census Masi for your attendance and participating in today's hearing. And for those at home, thank you for watching. The budget hearing on Bill 282-35 LS relative to the Guam Memorial Hospital is now adjourned at 11:06. And thank you very much.